Hi, my name is Madelyn Prodoehl. I'm a second-year graduate student in the Elmhurst Communication Sciences and Disorders graduate program. I will be presenting my research today on postpartum depression and the SLP. So my research title is called The Interprofessional Role of the Speech-Language Pathologist in Screening and Prevention for Postpartum Depression, Improving Outcomes for Mothers and Infants. Before I begin, I'd like to thank Dr. Carrico for being my research mentor throughout this process and supporting me throughout my research. So, just to give a little background before we start, I'm going to start with background, give you some information on postpartum depression and speech-language pathology as a whole. I'll go into the purpose of my research, and then I'm going to guide us into the literature review, in which I look at these 4 different topics, which I'll kind of explain later. And then finally go over the implications of my research and the why to everything. So, what is postpartum depression? Postpartum depression is a disorder that impacts around 15% of mothers in the postpartum period, as estimated by the CDC. Symptoms can include things like depressive episodes, feelings of hopelessness, loss of energy, interest, and pleasure, and sleep disturbances and emotional ability. In some, it can even lead to suicidal ideation. It often is caused by significant changes in hormones and lifestyle that comes with motherhood, and it has impacts on mental health and poses significant risks to the overall health of both the mother and the child. Some risk factors for developing postpartum depression include biological predisposition. So, if those in your family have experienced postpartum depression, you may be more likely to. Other things include physiologic stressors, so those changes in hormones that we see in new mothers. And the last important one is social support, so the support that you're getting around you. If you're not getting that support, you may be more likely to develop postpartum depression. And an interesting study I found is that 5% of mothers with postpartum depression report experiencing continued symptoms up to 3 years after birth. A lot of times we think of it as this transient kind of condition that mothers experience right after birth, but in reality, it can affect mothers for extended periods of time. So that's something really important to consider. And despite the high prevalence of postpartum depression, unfortunately, it's estimated that approximately 50% of mothers experiencing postpartum depression are undiagnosed by healthcare professionals. And that statistic kind of shocked me when I found it. So I wanted to know why. Why are 50% of mothers not being diagnosed and not getting the care they need? So I found this interesting article by Yu and Sampson from 2019. And in their study, they did a research study that talked to pediatricians and got their perceptions regarding barriers in care for mothers with postpartum depression. 84% of the pediatricians reported that there was a lack of time to care for these mothers. 53.7 or 53.5 reported a lack of familiarity with postpartum depression and the proper treatment. And finally, only 22% of those pediatricians reported receiving training for postpartum depression, recognizing it and giving the proper referrals. And these are doctors that are with new mothers all the time. So it was very interesting to see these statistics and see those barriers and gaps in the care that these mothers are not receiving. So, what does the speech language pathologist do, and how is this even related? Well, SLPs are involved in professional practice for communication and swallowing across the lifespan, and this can include collaboration with new mothers during early feeding, early intervention, and early childhood. So I thought, maybe these speech language pathologists could be working with mothers who are at risk of developing postpartum depression. So it is within the scope of practice to provide prevention measures for infants at risk for a variety of communication and language impairments. So my research kind of looks at these areas of speech language pathology and where that might fit in to care for mothers with postpartum depression. So the purpose of my research, I had kind of 3 main things that I wanted to look at. The first is to explore the impacts of postpartum depression on early maternal infant communication and child language development. So is there an impact of postpartum depression on child language development? And if so, what is our role as the SLP? The second is to review collaboration between SLPs and mothers at risk of postpartum depression. So are SLPs working alongside these mothers? Is that something that we might be able to have a part in. And then third is to determine if SLP services are relevant to the needs of mothers with postpartum depression and their infants. So what can we do? What is our potential role? Now I'll take us into my literature review. So I touched on these 4 topics throughout my research and found articles about postpartum depression and the SLP, where those kind of roles overlap. Postpartum depression and early communication, so those impacts on early communication. Postpartum depression and language development, so how children's language development is impacted by mothers with postpartum depression, and then current practices for treating postpartum depression and current SLP practices. So just to start, let's go over postpartum depression and the SLP. So I found some really interesting research studies that all found very similar information. So the first one by Tara Kelly in 2014 found that mothers of infants born into the NICU are, on average, 40% more likely to develop postpartum depression than mothers of infants born without any complications. And some of their studies that they found reported an increased likelihood of up to 70%. So this is a really high number. And as SLPs, we work with those infants in the NICU very often. So we might be working alongside these mothers that are at an increased likelihood of developing postpartum depression. Another study by Vigad in 2010 found a similar finding that mothers of preterm and low birth weight infants are close to 40% more likely to experience postpartum depression, and not only more likely to experience it, but experience it at increased severities when compared to mothers of infants born full term and with normal birth weight. The final study that I found by Gray and colleagues in 2012 was that infant temperament, partner satisfaction, depressive symptoms, they were all significant risk factors for stress, all of which was increased in mothers of special infant populations. And those stress factors all increase the likelihood of developing postpartum depression. So as SLPs, we're working alongside these mothers that, from this research, shows that they are at an increased risk of developing postpartum depression. So what is our potential role in kind of looking at this and being able to recognize that? And that's what I'll kind of get into later when I talk about the implications. Next, I researched early communication and postpartum depression. Before I get into the effects, I'm going to talk about early communication just as a whole to give a little bit of background. So mothers that have their infants often use what's called infant-directed speech. And this is characterized by communication with infants that has unique maternal prosody and careful responsivity towards their infant's needs. And research has shown that this responsive communication, along with really consistent language exposure, leads to better language development and outcomes for children later on. And then another study found that infants who are not exposed to this communication are at an increased risk for impaired linguistic learning and performance later on. So if they're not getting this input, they're at an increased risk for developing language disorders. So what does that mean for postpartum depression and early communications? Well, there were a few impacts on infant-directed speech that were found from a couple different studies by Kaplan in 2014 and Lamb, Cassaretti, and Koloff in 2020. Both of these studies found that mothers with postpartum depression spoke to their infants with decreased linguistic content, decreased pitch variation, decreased communicative responsivity, and these all resulted in decreased infant engagement. And they also found that mothers with postpartum depression have a lower ability to communicate with their infants and respond appropriately to communicative attempts. So these infants, as we know, are now at an increased risk of impaired language learning later on. So that made me curious, how are there long-term effects? Are there long-term effects of postpartum depression and that change in early communication to the language development later on in childhood? And there was kind of variable research found on this. So I'll kind of go over that a little bit. One study found that there was lower lexical processing abilities at 18 months. That was by Brookman et al. And they also did another study with the same cohort, and they found decreased expressive vocabulary scores at 18 months. In another study by Kaplan in 2014, they found that increased severity of postpartum depression correlated to decreased expressive communication in infants. However, the results were not correlated to receptive communication or general cognitive scores, so it was kind of mixed. Another study in 2016 by Vaya and colleagues found that persistent postpartum depression symptoms, so those symptoms lasting for 2 or more months, resulted in significantly lower communication scores at 12 months. However, those negative effects did not have long impacts at 24 months. And then another study by Smith Nielsen in 2016 found that there was no significant difference in development between mothers of infants who recovered from postpartum depression and infants of mothers who never experienced postpartum depression. So they argued that with improved depressive symptoms, the effects of maternal postpartum depression may not persist in the long run. Later onset postpartum depression was also demonstrated to have significantly lower expressive language scores, but it was not observed in early onset postpartum depression. So there's just kind of a variability to the types of symptoms mothers experience, when they experience them, at what severity. So all in all, with postpartum depression and that language development later in life, the research remains to be kind of variable. So this is an area where more research is really necessary for us to really get a general understanding of what is needed in this area. Now we're going to move on to current practices. I'm going to start with the current treatment for postpartum depression. So for screening of mothers with postpartum depression, this is often done by pediatricians or their primary care physicians that they see in the postpartum period. And one study from the American College of Obstetricians and Gynecologists found that screening mothers and providing that related support can decrease the prevalence of postpartum depression by up to 9%. And these are just a list of the different screenings that are used. The next thing that they do after screenings and providing support is through treatment. And they're treated through clinical, psychological, and even pharmacological practices. So that could be medical, it could be cognitive behavioral therapy, psychodynamic therapy, supportive counseling, anything like that. But I found this really interesting. So from those things, you can see that SLPs are not involved in this at all. It's not really something that's been brought to the table yet, but I found this really interesting article from Snow in 2009, and he's a researcher who argued that SLPs should have a role in kind of understanding postpartum depression and its effects on speech language pathology and what we can do to kind of help. So he argued that language competence is acquired in the relational milieu of early infant caregiver attachment and cannot be separated from mental health across the lifespan. So I found this just to be kind of eye-opening, and that like we as SLPs should be considered in this area, as we have unique knowledge on language competence and how we can help those early infant caregiver communications. Some related SLP services that are used, that have been used in the past, some are from the 90s and 80s, so they're very outdated, but they're used to provide counseling to facilitate responsive mother-infant communication and foster positive outcomes in receptive and expressive language in high-risk infants. And so obviously they would need to be updated and made unique for those mothers who are experiencing postpartum depression. But we do know that parent coaching is a very positive aspect of our profession as speech language pathologists. In 2020, Ramirez and colleagues found that parent coaching improved language development skills, and improved parent-child communication that enhanced language outcomes for infants. So we know that as SLPs, we can improve those language outcomes for infants that are at risk. And so that might be an area in which SLPs can play a potential role for mothers. So what are the implications of this? Well, the first one is that SLPs can potentially be involved in monitoring. We are working alongside these mothers that are at a higher risk of developing postpartum depression. So we should be able to have the knowledge to recognize when a mother is experiencing postpartum depression. We can work alongside other health professionals who work with them to make sure that we are recognizing these mothers and getting them the relevant care they need. The next implication is collaboration. We can promote interprofessional practice, we can fill those gaps and try to decrease that number, the 50% of moms that are going undiagnosed and untreated. We also have a unique ability to educate others about early communication and communication between the mother and infant, so we can collaborate that way with other professionals. And then the last way is through parent training. We can provide that counseling and training for improved early communication for mothers that are impacted by postpartum depression, so we can make sure that their infants are getting the care that they need. So as you can see, these are just a few potential areas that we as SLPs may be involved in the care for mothers and infants that are all impacted by postpartum depression. Overall, moving forward, there's just a need for further research to explore the SLP's potential role in improving outcomes for mothers and infants impacted by postpartum depression. But I found this to be a really interesting thing to research, as I was able to see that our profession could expand in this way and determine how we might be able to help these mothers. So thank you for listening. Here are my references, and thank you.